I see how many likes and all are coming in? Or?
Hey everybody, welcome to our very first get together to talk about the Mindfulness Meets Medicine push that we've got here in Greenville to start bringing together medicine, traditional medicine, with mindfulness and holistic health and integrative health, and to really start bringing us to the table to talk. So I'm very excited. My name's Peggy Zielinski. I'm the owner of Our Inward Journey, and I am partnering here with Dr. Bijoor of Oakview Medical Associates. And the two of us are really working together to bring Integrative Health Center here in Simpsonville. So first of all, let me just tell you a little bit about Dr. Bijoor so that you really understand who you've got that we're talking to here. Dr. Bijoor is triple board certified in family medicine, lifestyle medicine, and obesity or bariatric medicine. She's a fellow member of the Obesity Medicine Association, American Academy of Family Physicians, and the American College of Lifestyle Medicine. She served as the chief resident of the Medical University of South Carolina Family Medicine Spartanburg Residency Program. She's a medical director of several local organizations. She's a clinical instructor currently in medical aesthetics, lifestyle medicine, weight management, and primary care procedural medicine. She's a powerful speaker and motivational coach, and she's trained hundreds of clinicians and physicians, nurse practitioners, and physician assistants through preceptorship at Clemson Medical University of South Carolina and North Greenville University. She is so inspirational. Her passion for preventative health inspired her to start her private practice here in Greenville, South Carolina in 2008. Where she's also the medical director of a very successful non-surgical weight loss program. Her special interests are metabolic syndrome, age management, hormone optimization, functional medicine, insulin resistance, and customizing lifestyle medicine therapeutic programs for her patients. And this is where we start coming together. She believes in the collaborative, integrative, multidisciplinary approach to a patient's health. And she's passionate about helping her patients achieve optimal health and wellness one patient at a time. She's currently a member of the leadership panel of the Greenville chapter of the Holistic Chamber of Commerce. So that's what brings us together, is this common goal to serve the patients one patient at a time and the whole entire body and the whole entire life cycle. So welcome, Dr. Bijoor. Thank you for joining us today.
Thank you, Peggy. I'm so happy to be here.
Yeah, well, I'm honored that you can take time. I know you're crazy busy and you've got tons of patients that you're seeing every day. But what we wanted to do is just open up this conversation. You and I are going to be doing this once a month now moving forward, and really trying to engage patients in the different options that they have available throughout the course of their healthcare journey. So what I wanted to ask you today, first of all, I mentioned this integrative health concept. What is your vision? You know, how did this all happen, and what's your vision to kind of bring integrated health to patients in Greenville and Simpsonville?
For me, as a family physician, my background, I have a lot of physicians in my family, a lot of specialists, a lot of physicians. Growing up in that environment, I always kind of knew that I love to take care of patients, love to take care of people, help others. And as I finished medical school and then I chose my core residency in family medicine, I realized that family medicine is actually a very holistic approach to the patient's health. So we train in internal medicine, OBGYN, I've trained in deliveries and C-sections, and then also in certain specializations like dermatology and cardiology and rheumatology. So we get a very broad training in how to manage the patient on a very basic level. And that really is the key, because what I realized is I've got to start integrating everything and put it all together like the pieces of a puzzle. Mm-hmm. And I'm just passionate about that. I don't like to just take care of one system, but I tie them all together. And in the U.S. healthcare system that we're trained in, I found there are a lot of limitations which you don't realize when you're going through residency. You're in a very protected environment. When I graduated, I worked as an ER physician for the first 2 years, and I got a lot of hands-on you have that patient now. What are you going to do? What is your approach? So in a sense, the emergency, it sounds paradoxical, but the emergency system is, to me, also a very holistic approach, because you've got to analyze what's going on with that patient and tie in everything together, their meds and what brought them there, what created that emergency. So with that mindset, I realized that if we look at the root cause of illnesses and focus on the preventive standpoint, we can really prevent disease. And that's a very powerful thing. Just as an example, in depression, when we graduate and we learn how to treat depression, you traditionally start out with antidepressants. Well, majority of the antidepressants don't work and don't cure the depression. They may help the symptom, they may help them feel calm, but they don't really get to the grassroots level. So integrative medicine to me is looking at their lifestyle. It's very evidence-based. This is not, take a few herbs and just think you'll treat your disease, but it's very scientific and it's a very collaborative approach. So I started introducing, how do you sleep and what do you manage your stress with, and what kind of diet are you on? Are you eating a lot of carbohydrates? And to me, that made sense. If I integrate all the patients' environmental factors, their family, family stressors, everything that comes together, I was able to make an impact and really get them back to normal health, not just keep them in that state where I'm prescribing and they're coming back in 3 months and I'm just checking a medication. Don't get me wrong, I'm a board certified family physician, so I certainly believe in the utility of our medications and the tools we have as physicians, but I feel integrative health is really thinking about the whole patient. And to me, that is the core of our primary care medicine, or should be. And like me, most of our family physicians think at this level, and I'm so happy to bring this concept or bring this approach to Greenville. I think it's time. I think Greenville is ready for it. Integrative health to me is really the core basis of taking care of someone's health. So that's a long answer, but
well, no, it's a beautiful answer, and you're so speaking to the hearts of those of us who call ourselves holistic. I mean, it's so interesting because you're saying the same thing, which is such a beautiful thing. And I think that's where we can really make some bridges and build some bridges in the healthcare industry if we can start doing this exact thing, meeting in this common ground that we have of treating the whole patient and how important that is, and the individual patient, because no two patients are even alike.
Absolutely.
So when you agreed to become a part of the Holistic Chamber of Commerce and you agreed to be on our leadership panel, that just spoke volumes, because it's exactly what we've been looking for. Like, we need people, we need doctors who are evidence-based, who understand the science behind all of this, who can be there when we do need the Western medicine, when we do need that traditional, surgery and medication. And, some patients need insulin. Like, there are things that we need you for specifically, but it's so nice to speak with a provider who is really interested in looking at all kinds of options and really, holding that space for the patients. So thank you for that.
You're welcome.
And how do you envision your role with the chamber? I mean, do you, what brought you to as an interest in the chamber?
I think being a part of the Holistic Chamber of Commerce allows me to bring in all the different sort of services and providers that train. I mean, we have people that train in massage therapy, are certified yoga instructors, certified lifestyle coaches, certified in mindfulness like yourself. So we are bringing in, it's a hub for all like-minded individuals, professionals that believe in taking care of the patient, mind, body, and at the spiritual level, physical and spiritual health. I think that's so integral to taking care of the health of the patient that it just makes sense for me to be part of that at the grassroots level and see this really, evolve. And I'm so excited. Thank you.
We really are really excited. And so we'll be doing a series once a month, and each month we're going to pick a different thing to really focus on. And this month, since February is Heart Health Month, I just wanted to get some feedback from you on, what kind of recommendations do you have for patients when they're dealing with stress management? You mentioned that earlier, how debilitating stress can be. What kinds of suggestions or recommendations would you make to patients that are dealing with a lot of stress?
February is Heart Health Month, and I think it's a time for all of us to acknowledge that we need to take better care of ourselves, whether it is really, it's really important that just when we have children, our kids, we put them through their well child checks and get them with their regular checkups, the vaccinations, the weight check, making sure everything's. And then as adults, we kind of say, it's okay. Do I need to go and use the medical world as more of a sickness-based, just checking in when you need them? But if you go in for your talk to your provider, go in for your annual physicals, there are a lot of cancers that we can prevent with early detection, early screening. That's a very powerful tool. In Heart Health Month specifically, make sure you get your blood pressure checked. That's something simple that you can, it's a silent killer. It's actually the cause of a lot of deaths and hospitalizations with untreated high blood pressure. I think in terms of stress management, stress is very powerful. It produces a lot of the trigger that we absorb in terms of stress. We manifest that by releasing hormones in our circulation that then cause a fast heartbeat, cause us to have that flight and fright, adrenaline rush, and that keeps our blood pressure up. That stresses the system. And just stress management, could be something as simple as, I tell my patients, just breathing, just learning to slow down. I have to say this, my dad always, every time he talks to me, my mom will say, slow down. Are you taking care of your health? Just slow down. And I have to be mindful of that too. I'm also a human being, a mom, a wife, and with a busy practice. So I think we all need to just think about what is really important to us and simplify our life. You take time, don't say yes to all kinds of obligations and too many things going on. I think nurturing the relationships we have and all that really manages the stress better. And I go through that. Like, our office visits are not the typical quick, how you doing prescription type of visits, because that really impacts. I see when a patient comes in and the blood pressure is high, I can talk them through how to eat better, how to exercise. Sleep is another important factor that leads to better heart health too. So I think just taking care of your nutrition, taking care of your lifestyle, your sleep, all of this really factors into taking care and managing stress better. And certainly, mindfulness, meditation, yoga, very, very powerful tools to help us prevent disease. So.
Yeah. Well, and I think that there's this idea that anything that is holistic or alternative or integrative is not science-based. And it's really not true. I mean, even what I teach in mindfulness, this mindfulness-based stress reduction program, it's an evidence-based program that literally shows that if you get on this meditation routine for 8 weeks, it changes your brain.
Oh, dramatic. Yeah.
Physiology of your brain.
Right. Some of the top centers in the US and around the world have realized the benefits of having yoga, meditation, breathing exercises, stretching, Tai Chi, all of this into the physical health. And in fact, Duke has an integrative health center, Harvard, Johns Hopkins, UMass, all of these institutes, even on the West Coast, they have integrative health clinics, and they've seen a huge improvement in hypertension, diabetes, chronic disease management, back pain, back and neck pain. I call it tech neck, technology neck. We're all sitting on the computer and neck like this, and patients that complain of back and neck pain and headache. And I just say, have you thought about your posture? Because I've learned the hard way. I had a setback in 2011 where I had a severe back condition and I couldn't move. And I realized, oh my gosh, I was working, just not taking care of myself. And I then started focusing on posture and core strengthening, aquatic therapy. All of this is evidence-based. Just because you don't have a big pharmaceutical company backing it up, you can't really sell exercise as a pill, but exercise is a prescription. And part of exercise is relaxing your muscles. So how do you achieve that? You become mindful. You become aware of your surroundings and your breathing and the sounds around you. And if we would just take 5 minutes in a day, and instead of being reactionary, become proactive with our health, we can walk our selves through a lot of physical symptoms that we experience. Patients that come in with finger, like hand tingling, numbness, many times we call that paresthesias. Of course, you want to check in with your nutritional support, your vitamins, make sure that there's no underlying medical illness. That's where you want to work with a physician or a practitioner that
Mhm.
can analyze that, can do some diagnostic tests. But many times it's just walking them through understanding the mechanics of what is producing that tingling in your fingers.
Yeah.
You
Yeah.
pinching a nerve somewhere in your deep musculature, and can you relax that? We incorporate physical therapy or aquatic therapy or posture and core strengthening, yoga,
Mhm.
and it goes away without having to put them on pain medicines and muscle relaxants. And we're just treating symptoms. So medication has a place, has a very good usefulness in medicine, of course, but I think it's time we realize the benefits of all. Traditionally, we're trained in just thinking of the other aspects as a, just like a sleeve, and everything else is more important, the inside the sleeve. But actually, if you take the core as your integrative medicine and focus on the lifestyle and wellness, then you prevent disease. It's just a happy state to be in. I think it's a no-brainer.
Yeah.
If
Yeah.
all of our physicians, we have huge networks of physicians now, with social media, that we
Mhm.
all have this like-minded approach. We have a huge following in lifestyle medicine, a lot of physicians, and I'm just blown away when I go to these conferences and meet some of the top providers in the field that are on TV and media, and they're all speaking the same language, that it's about time we take care of our nutrition, our diet, our exercise, our sleep,
Yeah.
stress management, and the whole patient, not just. So to me, that's what holistic is. Holistic is not taking an herb instead of treating your cancer with the appropriate chemotherapy or drugs. You don't do that, but you use it as an adjunct, as a support, or you use mindfulness as a support to get you through something like diabetes or heart disease, or you just come out of the hospital. If you learn to take care of your wellness side, then you don't have to invest too much in the disease side of things. So
Yeah.
that's
Yeah.
yeah.
And that's beautiful. I mean, we would all love to prevent this issue rather than having to fix it and put a Band-Aid on it and try to fix it after it's broken. And
Mm.
that's a lot of what my company, the whole our inward journey, this whole
Right.
notion that we need to come back to ourselves.
Mhm.
We can let everything that's going on outside of us run our lives, but at some point we have to change our reactions into thoughtful response.
That's
And
right.
there needs to be an amount of space created in order for us to do that. So there are tools and techniques that we can use in the mindful community that work so well in the medical community. And so it's such a beautiful thing that we're able to partner together on that.
Absolutely.
So what words of wisdom would you offer patients when it comes to maintaining their heart health?
In maintaining your heart health, it's important to be physically active. I think we, as a population, we don't, in general, Midtown America, we don't have access to public transport, and we rely on we drive our cars everywhere. We just get in and out of cars, and then we're sedentary. Be
Mhm.
active. Even
Mhm.
5-minute bursts physical activity multiple times during the day, taking a walk during the day, during your lunch, not just sitting and eating, but eating your food and then taking a walk, drinking lots of water. All of these are cells in hydration. So if you think about our muscle health, the heart is a muscle too. You got to keep it well hydrated, keep our volume in adequate. And that's important in terms of heart health. Also, in terms of nutrition for the heart, there's so many resources out there available now. But really following a whole food plant-based diet is
Mhm.
it's very evidence-based. And I've trained with some of the cardiothoracic surgeons that are in the field of lifestyle medicine, like Dr. Esselstyn, and he's written a great book that everyone I think should read called How to Prevent Heart Disease. And it
Mhm.
talks about the benefits of nutrition. And he's actually shown cath photographs after cardiac cath showing the plaque that actually diminishes, with just a healthy diet and lifestyle. So
Wow.
uh, I mean, it's mind blowing. And we're at this time where I think we really need to take advantage. There are a lot of health food stores. There are a lot of nutritional options. Talk to your provider. We are we must be knowledgeable about the different options out there in terms of nutrition. So I've
Mhm.
created an integrative health center here at Oakview as well, and we've brought in like-minded providers that can provide their expertise to our patients, and just make it better for everybody.
Yeah.
I think in terms of heart health, the other thing one can do is get adequate sleep, like I touched upon.
Mm-hmm.
If you don't sleep about 7 to 8 hours a night, I think that really creates some tension in the blood vessels, in the vascular system, and that lack of the relaxation in the heart. If you don't get that, then there's a lot of these hormones that are released. We're realizing the impact of all of that. So yeah, there are medications if you need it. Absolutely do not neglect that, but also have a very wellness-oriented approach to your health, a preventive approach.
Yeah, I love that. I love that. Well, let's do this. Let's make sure that anybody who's watching knows that we are doing an integrative health fair this weekend here at Oakview Medical. So for those of you who would like to learn a little bit more about what we're doing here, what we're creating here with this Integrative Health Center here at Oakview, please join us. That's going on all day on Saturday from 9 to noon. It'll be more like an expo style where you'll get to meet the nutritional therapist that we have here on staff. And we've got a person doing permanent makeup, and we can talk about mindfulness. And Dr. Bijoor will probably be around during the day at some of that too. And then from 1 to 4, I'll be doing an introduction to mindfulness. So as Dr. Bijoor mentioned, it's really important that we take that breath, right? That we're able to come back to ourselves, create space so that we're not reacting. We're doing more conscious responding to things that show up in our world, and that we're creating time for ourselves to really become more aware and to do that preventive work so that we know when something's wrong. You know, when we go in and we get things checked and we follow through on that. So please join us this weekend. On Saturday, I'll be speaking from 1 to 4 on that intro to mindfulness. We'll actually be practicing some of those mindfulness techniques during that intro as well. So join us here for that. Tonight, we've got the Holistic Chamber of Commerce meeting here at Oakview Medical Associates as well. So if that's interesting to you, please grab it, jump into your car. We start at 7 o'clock here at Oakview tonight. And look for these continuing conversations that we'll be having. Next month, March, is allergy month. So we'll probably be talking a lot about how to better manage our allergies and what we can do to maybe prevent some challenges and maybe what to do when they do show up. So you can look forward to hearing more about that next month. Anything in closing, Dr. Bijoor, that you'd like to share?
I think, you know, as a physician in the community of Greenville now, I've been in practice at Oakview Medical for 11 years, but I've been out in practice for almost, that makes me feel old, but like 17, 18 years now. I've seen the change in our community in terms of the options we have, the wellness options, the gyms out here, the beautiful weather we have, usually not like today, but the weather we have in Greenville, and the Swamp Rabbit Trail. We have so many opportunities to become active. Just let's reach out to one another and let's be one another's support system. With social media and all that, there's a lot available. There's a lot of negatives, and people talk about you think about, oh, should I go in? I had some patients, that I when with anxiety or depression that I've said, oh, have you seen a therapist? Have you talked about? Do you know cognitive behavioral therapy? Have you met anyone about mindfulness or yoga? There's not a good general awareness, right? So I think be open-minded. Because you'll miss out otherwise. You won't know the options that are available in integrative medicine, functional medicine, wellness across the board. We're brought up in a certain mindset, and to change those behaviors, it sometimes takes working with our patients. I've seen one of my patients for past 11 years, ever since I opened practice at Oakview. And I saw the wife today, just for an example, and I've been trying to get him to quit smoking for 11 years. And, always, but no, I'm happy. It's fine. Not a big deal. It's what I've always done. And, but recently we had to do some diagnostic testing, and we know that there is plaque buildup in the blood vessel. So I was talking to him probably over the last 6 months about how to change the diet. If you don't want to give up tobacco, maybe you can just start eating better and start becoming active. So I got him, involved with the local gym, some core strengthening, one of the physical therapists I knew, not just addressing, yes, he's on an aspirin, he's on some medication for the plaque and the cholesterol buildup known as a statin medication. But I kind of I said, okay, let's not talk about tobacco, but let's address some of these other factors that can help. And believe it or not, I was shocked. She told me he's actually quit smoking. So I gave her this big hug, and I was so happy because to me, we don't give up as clinicians, as practitioners. We keep persisting and we keep discussing, because if we don't do it, who's going to do it for that patient? If environment where the spouse smokes or they eat bad food, where are they going to get that support system from? So reach out to your provider, recognize that, and be open, be mindful, be open to opportunities. You never know. I mean, I am blessed to have the patients that I have. I'm truly blessed. I wake up every day, I'm so energized to go to my office, because I feel I learn so much from my patients. And it's not just me telling them what to do, but I'm a human being too. And I'm learning constantly from their behaviors and talking to them. So I'm so passionate about family medicine. I couldn't tell you, I love the medical practice. Now, insurance part of it, I can have
so much.
how insurance ruins the doctor-patient relationship. It truly does. It's the middleman that doesn't cover healthcare. And that's unfortunate, but there are patients that recognize the value that we provide as clinicians. There are, and they do what I like them to do. We call that a compliant patient that follows through what we tell them to do. And I'm blessed to serve those people that value that. And I think being in Simpsonville, being in Greenville, it's a great location, great area there are a lot of new communities, make friends, go out, socialize, build a good community for us, for one another. And we have great things coming up. I mean, I am really taking this to the next level in terms of, I don't think there's anyone, I hope to collaborate with other providers. What I'm planning on doing is introducing some of my oncologist colleagues, some cardiologists, some rheumatologists, and bring in their take on how integrative options can provide improved outcomes in all these different disease states.
I love that.
I think it's only going to get better from here. So
well, and the one thing I would add, just because of those of us that are more holistic minded, it's important to have the partnership, like not just throwing away the doctor and running into the holistic options. Like we really need a partnership.
We do.
And I think that's the thing that's missing on the holistic side. I think that the holistic, the mindset tends to be anti-allopathic medicine. And it doesn't have to be. Like it really doesn't have to be. You just have to make sure that you have a provider that you can have those conversations with. And there are not a million of them out there, and so.
Yeah, and there's not too many passionate about that kind of training. So, it was very expensive, or is very expensive for me to go out there, do all these conferences, invest my time amidst 3 children, and go and get board certified and do all the hours it takes. But it's very valuable for me. I didn't have to do it, but I chose to do it because I felt like I now have the tools and the resources and our professional community to help our patients in Greenville and really, just improve the quality of care. So that was very important to me. Likewise, every practitioner, whether it's an MD or DO or NP, nurse practitioner, or mindfulness coaches, nutritionists, yoga therapists, we're all in this together. We're all helping some aspect of the patient's health. And even for the non-MD providers, I think it's important to learn to collaborate with them. If you're working with one of your clients on yoga and physical therapy, talk to the MD. I'm so happy when a massage therapist or physical therapists call me all the time. And guess what? The ones that keep that relationship with me, that's because for me, that patient is in the center, and we are sort of their supportive framework that will help them through their disease and get them to health. And once they're at the health state, we will support them throughout life in whatever way they need us to support them. So I think we need to collaborate as providers or practitioners, and it only gets better. It's fabulous. And I see that in every day. So I'm really excited.
Well, stay tuned because we've got more coming. So we're going to end this for tonight, but thank you all for joining us, and we'll share this broadly throughout all of our groups so that we can share this message. And if you've been inspired by the message of what we're doing, please do that for us and share this around as well so that we can get the word out that we are doing this. We're doing this integrative health concept, and we're really bringing more options and working on the whole patient throughout their entire life, which is such a beautiful blessing. So
Absolutely.
thank you so much for your passion and your interest in this and for helping us build this, because
Thank
so
you.
important.
Yeah, it is.
All
And
right.
thank you for doing this too. We have a lot of viewers, I see. If anyone has any questions or
Yeah,
comments,
you're welcome to comment.
yes, please let us know. I'm here to answer any questions, and um, or just
Yeah.
call us. Oakview is 864-627-0444. And we're available. I do a lot of consultations. We're just there for you. And I think we all do that. All of us at the Integrative Health Center here at Oakview, we talk to our patients. We give them our time, and build that trust and that support. So
Yeah, and it's something that you don't get very many places anymore. Everybody's in such a hurry. So it's really nice to be able to come in and feel like you've been heard, that
right.
somebody's actually hearing what you're saying.
Yeah.
So, all right, well, we'll end the broadcast for this time around, but pay attention to everything we've got going on. You'll see lots more notices. If you can make it to the expo on Saturday, please join us. Thank
That's
you, Dr. Bijoor, for
Yes, it's
being
free
here.
Saturday. Just wanted to end by saying the Integrative Health Fair is the first of many that we're going to be doing. And, we as a practice are blessed to have a lot of patients in Greenville, and it's open to everybody. Please come on in, have a good time. It starts at 9. I believe it's till 4.
Yep.
And just, if you have questions or anything, that you want to ask about, I'm available. So it'll be fun. So.
Yeah, and feel free to reach out to me as well. All right. Well, you have a beautiful evening. Stay warm out there in Greenville and stay safe. And we will talk again soon. Thank you, Dr. Bijoor.
Good night. Bye-bye.